Hello, and welcome to today's health webinar. This episode is brought to you by our health advisory team. We would like to remind you that the Q&A feature is available, so feel free to send in your questions and comments throughout today's webinar. We would love to hear from you. And with that, I will turn it over to our Digital Health Innovation Senior Consultant, Cristina Conesa.
Thank you, Nikita. Hello, everyone, and welcome. Thank you very much for joining us today for this health advisory webinar on the Chinese digital health landscape. Before we begin, just a quick note that throughout the session, please feel free to add any questions into the chat, and we'll make sure to address them during the Q&A at the end. Over the past few years, we've seen a growing shift of how global pharma, digital health companies, investors, and healthcare systems think about China. Increasingly, it's no longer viewed simply as a commercial market, but as a source of digital health innovation, operational scale, and entirely new care delivery models. At the same time, many organizations entering China still approach it using assumptions built in the US or Europe, and very often those assumptions break down. And particularly over the last 24 months, we've seen the convergence of AI maturity, payment reform, internet hospital scale, and platform infrastructure create a very different digital health environment from the one many organizations encountered in China 5 years ago. So today, what we really want to do is unpack how the Chinese digital health system actually operates, what kinds of models scale successfully, and why China behaves less like a traditional digital health market and more like an integrated health operating system. Before we begin, just a quick introduction to Health Advisory. Health Advisory is the consulting and strategic insights division within health. We work with pharma, biotech, health systems, payers, and digital health innovators globally, helping organizations understand emerging healthcare markets, technologies, and adoption dynamics. A large part of our work sits at the intersection of digital health, AI, care delivery transformation, and market access. And increasingly, China has become one of the most strategically important markets in those discussions. Many of today's insights come directly from work we've done exploring Chinese digital health ecosystems, platform models, AI-enabled care pathways, and digital infrastructure trends. And now, just a quick introduction from both of us and a brief overview of today's discussion. My name is Cristina Conesa, Senior Consultant at Health Advisory, and I focus primarily on digital health innovation, healthcare ecosystems, and emerging care models across global markets. And I'm joined today by my colleague, Parik Hughes. Please, Parik.
Yeah, thanks so much, Christina. Hi, everyone. My name is Parik Hughes. I'm a consultant also on the Insights Advisory team alongside Christina. A brief background to myself. My research background spans both chemistry and computational structural biology, where my last engagement was around adapting AI models to help in the molecular modeling of molecular modeling tools. My in-industry experience has been across a few different technical roles on major pharma, mostly in the vaccine manufacturing space. And then lastly, my work with health has spanned a lot of different areas, but mostly on emerging technologies in digital health and exploring different markets and to see how they can be leveraged by companies within the digital health space. So thanks, Christina.
Thanks, Parik. So today's session is really structured around one core question. Why do so many global assumptions about digital health break down in China? To unpack that, we'll first look at the core misconceptions surrounding the Chinese market, then how the system actually functions operationally, what kinds of models scale successfully, and finally, what this means strategically for companies looking to enter or partner within the ecosystem. We'll also spend some time looking at two areas we think are particularly important: agentic hospitals and surgical robotics as digital infrastructure. So with that, let's set the scene. I think one of the most important starting points is that China is operating at a completely different level of speed, scale, and innovation density than most Western healthcare systems. When we think about digital health in Europe or in the US, we often think about apps, point solutions, or isolated digital tools. But in China, digital health has increasingly become embedded directly into the healthcare operating system itself. And that changes everything. Today, China already has thousands of internet hospitals, massive platform ecosystems, embedded digital payments, AI-assisted workflows, and increasingly strong policy coordination around healthcare AI and digital infrastructure, as we will see. At the same time, China is dealing with enormous healthcare pressures: rapid aging, rising chronic disease burden, hospital overcrowding, and workforce constraints. Digital health is not being positioned as optional innovation anymore. It's increasingly being treated as system infrastructure for care delivery. And that's why many global digital health strategies fail in China. Usually not because the technology is weak, but because the assumptions behind the business model are wrong. Because what works in the US or Europe does not necessarily map cleanly into the Chinese system. In the West, digital health is still often approached as consumer-led market. Typically, you build a standalone app, you generate engagement, and then pursue reimbursement later. Innovation competes for reimbursement. China operates very differently. The Chinese model is hospital-led, platform-embedded, payment reform-driven, and highly coordinated. In practice, innovation succeeds when it aligns with broader system reform. And this is a very important distinction. In China, companies are often not asking, can we convince the system to reimburse this? They are asking, is the system already incentivizing adoption in this area? That's a completely different operating logic. And it means China does not really function as a standalone digital health market in the Western sense. It behaves much more like an integrated health operating system, where hospitals, payment reform, digital infrastructure, logistics, and platforms all evolve together. And with that, I'll hand over to Porrick, who's going to walk us through how this system usually functions in practice.
Yeah, thanks, Christina. So I would like to speak first about some of the important governance machinery that is worth taking a note of when exploring the Chinese market. I have seen the descriptions of the Chinese market as one that is a system without a single coordinating center. And while that is definitely true to some extent, we do see national policy as the starting point for a lot of the digital health direction that we see. So starting at a national direction or federal level, China is a pretty well-oiled machine when it comes to designing national direction in technology development. In this way, a national direction for digital health is very aspirational and outcome-based. Multi-year modernization plans such as Healthy China 2030, which is a blueprint to fulfill the country's long-term economic and social development goals, along with Internet plus Medicine and Health, which is an overarching framework to integrate internet and information technologies into healthcare, all wrap everything together. And it's really all about aligning health with AI and industrial incentives. So looking at the next layer, policy engines are subsequently responsible for incentivizing, fulfilling the national direction through actual policy, through clinical standards, through reimbursement models, as well as regulatory guardrails. And that last point is obviously very relevant to the likes of AI development and AI governance. In summary, these shape how digital tools enter and operate within that system. And finally, this is a very China-specific characteristic, but local adoption and implementation China is very specific when it comes on this. When it comes to this, different regions, different provinces, different free trade zones, for instance, or FTZs as they're known, have very specific action and work plans which operationalize the national policy at a local level. This can take many different forms. So, for instance, they might be incentivizing an adoption on certain care types, whether it is AI in clinical care, traditional Chinese medicine, public health, whether it's certain use cases, be it medical imaging or diagnostics. There could be adoption at very hospital level as well. So certain tertiary public hospitals may be incentivized to roll out technology. And also, it's worth saying that we do also see data aggregation and AI model training happening at a regional level, at a provincial level, where assets are pooled maybe across hospitals or even private players if they opt in. So again, very local adoption focused. So whereas that slide focused on governance and policies, I do want to speak through how adoption actually occurs. So the flow of adoption. As mentioned in the previous slide, state mechanisms are generally the first port of call. These create structural pressures for the adoption and embedding of digital health technologies. A really important part of this is the second point down, DRG and DIP incentives. What these are essentially health insurance payment reforms. They've come in the last several years, but they create more incentives for hospitals to seek out the use of digital health technologies, ultimately to achieve better results in their own hospitals for care delivery. We're talking about more patients, better outcomes, in summary, just more economical for the hospitals. And so carrying on that thread on hospitals, we have learned that hospitals fulfill an extremely important role within adoption within China. Generally, they are seen as a gating authority for adoption. Hospitals themselves control procurement and vendor selection. And so they are the ones responsible for redesigning clinical pathways themselves. And so it stands to reason that they're the ones to absorb some of that operational and regulatory risk. So the lesson here is that hospital buy-in is very important. And then finally, as a byproduct of the central role that hospitals play, we do see some actors scaling around these hospitals. We see platforms, super platforms, as they're also referred to, who have very expanded logistics, engagement, and payment rails. We also see a relationship with insurers that typically insurers recognize the clinical evidence that is being generated in hospitals, and then as a subsequent measure, they might expand their coverage to those technologies. And an accessible rule of thumb in this sense is that the capital to scale is often in response to successful integration in the first place. And so it's worth pointing out maybe how some of these different players actually relate to each other. So what sort of positions do they take up in relative terms? So at core incumbent level, these are really the set established players. Publicly, regulators is first on this list. As with every other market, these are at the core of digital health landscapes. Hospitals, more specifically, public tertiary hospitals have a very important role in that they're instrumental for piloting, adoption, and scaling some of these technologies. And finally, payers. In China, more than 95% of the population is covered by public insurance. And while private insurance does exist, it makes up a small proportion of that, pretty much a supplemental layer that tops up gaps in the public coverage. And also, as we've learned, to cover some more high-end services as well. So alongside those, even though we have huge private players, they somewhat do work around some of those regulators, hospitals, and payers. Big platforms. This is a real characteristic, an identifying feature of the Chinese market. Alibaba Health, JD Health, Tencent, just to name a few. Huge end-to-end service offerings around e-pharmacy, telehealth, internet, hospitals. Large infrastructural players as well. Cloud vendors, Ping An Health, Huawei Cloud, Alibaba. And then finally, as I mentioned, just private insurance tends to skew towards the coverage of higher end services. But what I would like to be understood is that a lot of the innovation tends to emanate out from some of these core players that are not really to be budged. And some of those areas are interesting to look into. So clinical AI and software as a medical device. This is definitely one of the most active areas. Innovators depend heavily on hospital data access and tertiary partnerships to train, validate, and deploy their AI models. They fit cleanly into clinical workflows that ultimately the incumbents have already built. Digital therapeutics and chronic disease management. This is a growing category for diabetes, cardiovascular disease, oncology pathways as well. These innovators tend to ride on top of existing platforms and hospital rails to reach patients at scale rather than trying to build entirely their own distribution. Surgical and rehab robotics, an interesting and strong area for China as well. One of the world leaders for sure. Innovators here tend to feed into hospitals' smart operating rooms and some of the tertiary rehab workflows. And finally, elderly care, virtual care. Again, another niche, but an important area. It's becoming more and more important given that China has been designated by United Nations standards as a deeply aging society. And by 2035 is set to reach super-aged society status. So it makes sense that elderly care and by extension, virtual care for giving at-home care to a lot of these elderly patients is going to become more and more important for innovation. And indeed, a lot of the players are filling the gaps of what isn't covered by some of the big players already.
Thanks, Barry. So having looked at how the ecosystem functions structurally, the next question becomes what actually scales successfully within this system? And what becomes very clear is that scale in China is rarely driven by standalone innovation on its own. The models that scale successfully tend to share a few characteristics, and here we name some of them. They are platform embedded, they are hospital endorsed, they are aligned with DRG, DIP incentives, as Porrick mentioned before, and integrated into existing reimbursement or operational flows. And they must be policy coherent. By contrast, many models that struggle are highly familiar Western patterns, like standalone apps, consumer-first clinical models, or digital therapeutics waiting for entirely new reimbursement categories. China tends to reward solutions that fit existing infrastructure rather than solutions asking the system to redesign itself around them. So when we go to where to play, these execution-ready domains that are already operating at scale, we have to see where do we actually see this operating successfully today? And we've presented here some of the areas. First, internet hospitals and virtual care are already operating at an enormous scale. We now have thousands of licensed internet hospitals, reimbursed online consultations, and increasingly AI-supported outpatient coordination. Second, e-pharmacy and last-mile delivery are highly integrated into the patient journey, and you can see here some of the providers. Prescription fulfillment, payment, logistics, and delivery increasingly operate as one connected flow. And in practice, a patient can move from online consultation to e-prescription to same-day home delivery inside a single platform ecosystem. Third, we would have AI imaging and diagnostics that have become one of the clearest examples of hospital-integrated AI scaling in practice, particularly in oncology and cardiology. And finally, we would find the Gen AI and clinical large language models, which are now moving into real hospital workflows. We have MDT preparation, clinical documentation, ICU support, and administrative automation, just to name a few examples. And what's important here is that these are not isolated pilots anymore. They are operational infrastructure layers already embedded into day-to-day care delivery. Next wave infrastructure, as we've named it, are the targeted partnership and scaling domains. Alongside those execution-ready domains, we also see a second layer of infrastructure beginning to scale. Wearables and remote monitoring are increasingly fitting into cardiometabolic and chronic care programs. Real-world evidence and data platforms are becoming strategically important, particularly around oncology and rare disease evidence generation. Robotics is evolving rapidly, not just as surgical hardware, but as part of digitally integrated operating rooms, as we will see in a minute. DTX and disease management tools continue to gain traction, especially when embedded inside hospitals or WeChat-based ecosystems, rather than operating as standalone applications. What's most interesting is that many of these categories become stronger when they are combined together. And robotics is probably one of the clearest examples of how China is converging AI, data infrastructure, imaging, and hospital workflows into unified operating systems. We move to the next slide, please. We have here a spotlight, surgical robotics as digital health infrastructure. One of the areas that we think is particularly interesting and also highly misunderstood from outside China is robotics. Because China is no longer treating robotics simply as a standalone medical device category. What we increasingly see instead is the emergence of a digitally integrated operating room. China is now one of the fastest growing surgical robotics markets globally, supported by smart hospital programs, AI investment, and strong domestic manufacturing ecosystems. And importantly, these systems are no longer operating in isolation. They are increasingly integrated with AI imaging, navigation systems, intraoperative analytics, hospital IT infrastructure, and even 5G-enabled remote surgery pilots. So the operating room itself becomes a connected digital environment. And this is where China becomes strategically very different from many Western markets. Because in Europe or in the US, robotics is still often discussed primarily as a hardware. But in China, robotics is increasingly functioning as a data-generating infrastructure. And the value is not only the robot itself, it's the surrounding ecosystem. The imaging layer, the workflow layer, the analytics layer, and ultimately the longitudinal data being generated around procedures and outcomes. And that's why companies like Microport, Medboat, TNavi, United Imaging, and Fourier Intelligence are becoming strategically important players far beyond pure robotics. Because they sit at the intersection of AI, data infrastructure, hospital digitization, and procedural care delivery. And ultimately, what China is building is not just robotic surgery capacity, it's digitally integrated surgical infrastructure. The transition would be, and in many ways, the same convergence logic is now beginning to extend beyond surgery itself and into broader hospital operations. So with that, I'll hand back to Porrick to take us through what may become the next evolution of this model, which is the rise of agentic hospitals.
Yes, thanks, Christina. So as she mentioned, this is really just about the next evolution of a trend that we already see within the Chinese digital health market. So what is that trend that we first saw? Well, AI-assisted care has just become so strong in the country. It's really become embedded to a high degree. The country at the moment has more than 33,000 licensed internet hospitals, and these include reimbursed online consultations. These can be understood as a virtual parallel version of the hospital alongside the usual brick and mortar buildings. And so the next evolution on this is an agentic version of it. And so what is an agentic hospital? Well, it's a fully immersive, closed loop virtual ecosystem powered entirely by autonomous AI agents. So in this system, all nurses, doctors, and patients themselves are represented by autonomous agents powered by large AI, large language models, simulating a closed loop process. In itself, this is only an AI architecture, but what they have done is this has been deployed and adapted to real life. So where the AI mimicked patients are in the architecture, they've been swapped out with real patients. And so what we essentially have is a hybrid structure where these autonomous AI nurses and doctors are inserted before and after the physician touch point. And during the actual consultation itself, it's used more of a human with the human in the loop approach, more of an in-consultation decision support. But it does mean that either side of that physician touch point is almost 100% fully automated. And there's a few reasons why China are able to accomplish something like this. One, around patient identity. There's already pre-existing WeChat systems to link patients physically to the virtual counterparts as they go through some of these systems. On payment, digitization has already been well enabled. A lot of the big super platforms that we mentioned in these slides already have these kinds of capabilities. Centralized hospital governance. So generally, those responsible for hospitals are centralized. They're close by. It allows them to have very close touch governance over these kinds of hybrid systems, which is important just for safety and security. As we mentioned as well, DRG and DIP, which are the payment insurance reforms, they further incentivize these kinds of efficiencies. And that's exactly what the agentic hospital model brings. And finally, and this is one of the most important items of all, it can deal with such high patient volumes, which really lends itself to rapid AI iteration cycles. I think it can deal with approximately 10,000 times more patients than a normal brick and mortar physician sort of could deal with. And so, just coming towards the end of the slides themselves, we wanted to have 4 meaningful takeaways for people. So both entrants and just people looking to innovate in the Chinese market. And so the first one is clinical endorsement by hospitals should be seen as an entry point for digital health tech. People can fall into the trap of treating hospitals more as customers rather than front door adopters for technology, and we think it's important not to do that. In China, hospital integration is the first step along that journey of procurement, adoption, and then reimbursement. For instance, we see that many direct-to-consumer disease management apps often get a lot of interest, attract interest, but they don't fully scale until they're attached to a hospital department, an internet hospital, or a physician network. The question people shouldn't be asking themselves is less, is this clinically clever, but does this work under DRG, DIP procurement and fund control logic? So NHSA's 3-year action plan has pushed this insurance payment reform procurement across all different inpatient institutions across broad disease and fund coverage. Don't get us wrong on this one. On point number 2, innovative tech will always have potential for adoption, but the true enabler of adoption and scale is if they improve hospital economics. Point number 3, platforms as infrastructure, not channels. So Tencent, JD Health, Alibaba already sit inside appointment, payment, consultation, pharmacy, and follow-up flows. And what we see on this is that entrants that insist on owning those patient channels right from the off often discover that acquisition is expensive and trust conversion may be weaker than if they were simply to embed into an existing hospital pharmacy or a platform flow. And finally, a China strategy should be executed provincially. So all of your considerations and assumptions should not just be a function of national direction, policies and incentives, but a function of what a local province and region can provide. So we recommend to fully explore the nuances of strategic directions, because these, again, change region by region, and what kinds of pilots they offer. An example of this is that companies often end up resequencing market entry. So we recommend to use a free trade zone or a pilot jurisdiction for evidence generation, for access and for data handling first, and then looking to expand once some of that local procurement and operational rules are more clear. And so just to reiterate some we've already said, take-home messages. If there's one thing to take from today, it's that China rewards the structural alignment over experimentation, and that companies that win in the market aren't necessarily the ones with the strongest product or the boldest go-to market plan. They're the ones whose offering fits nicest into the system that already exists. Secondly, scale comes through hospitals. They sit at the center of procurement, clinical workflow, and reimbursement, and nothing meaningful moves without their endorsement. Adoption follows payment reform. As we mentioned, DRG and DIP are what make digital tools economically rational. And finally, large-scale distribution runs through these platforms. Think of Tencent, Ali Health, JD Health, because identity, payment, care delivery already run through those different rails. And so the failures we see in China aren't necessarily execution failures, they're more of a model transfer failure. So read the system first and then build for it. Okay, so that brings us to the end of the slides. Thank you for everyone for dialing in. I'm conscious that we probably have some questions that have been logged in the meantime, and Christina and I will have a look at them and endeavor to give people some responses. So let us just do that. Okay. So I've seen one come in just initially that I think we can field first, just to kick us off. And this question is asking us around DTC, so direct to consumer. What is the DTC situation like in China? Is it feasible, and how does it compare to the US? So with DTC, China is pretty far down the line with DTC, although to be fair, it does work very differently to the US system. There's huge adoption of consumer tools, and the super apps that we showed in the presentation. A really notable example that just comes off the top of the head is last year, Eli Lilly with JD Health, and I think they partnered to offer online consultations, e-prescribing, and delivery of obesity services. So again, it's a really high scale, sort of notable example of pharma companies partnering directly for DTC. And I think when you couple that with some of the major platforms like WeChat and Alipay, you can offer patients the whole care journey, essentially all through direct to consumer. So it's been working really well, I would say, is my assessment of it, but it wouldn't be fully true to say that it's the default route to scale, I don't think, in China. A lot of the digital care, as we mentioned, is still hospital anchored, and the most the most used digital journeys are still being filtered through hospital workflows. So although it's really far down the line, hospital workflows still have a very important role to play there. And just because I know it was the second part of that question, how does it compare to the US? Well, the US is massively different. First of all, the US is almost exclusively cash pay when it comes to direct to consumer. It's really the other end of that spectrum. It's almost always out of pocket. There's a lot of standalone platforms as well. For instance, Hims and Hers, Row, various different GLP-1 telehealth providers, I think, as well. And really, I think a lot of those are there because they allow people to go around some of the slow, fragmented systems of traditional care. I use that obviously within quotes. And so that's really how it's ended up with the purely out-of-pocket approach, whereas China's is a lot more integrated and it's all super platforms rather than the US, which is standalone. So hopefully that offers that person just some information.
Thanks, Parag. I can see another question coming. Cross-border data transfer, how realistic is it? We would say it is possible, but it needs to be designed very carefully from the very beginning. China cross-border data regime has become somewhat clearer since 2024, the CAC updates, which introduced more structured routes and exemptions for some outbound data transfers. This gave clarity, as I was mentioning, but healthcare data remains highly sensitive, and companies still need to think carefully about data classification, consent, security assessment, standard contract, certification routes, whether the data qualifies as important data or sensitive personal information. This makes a huge difference. So I would say like the stricter area is human genetic resources. Everything that has to do with genomics, human genetic data remains highly subjected to dedicated HGR regime, which restricts a lot how foreign entities can collect, use, store, or even transfer Chinese human genetic resources. This is like still a black box. So the practical answer would be don't assume free cross-border portability. For most pharma or US or AI use cases, you should assume China resident data infrastructure, local processing, minimized export, and only transfer like in an aggregated or approved outcomes, outputs where legally possible. So complicated to answer.
Great. I've seen another one pop up that I think we can field. Someone has asked around how do you actually partner with some of those big platforms without being dependent on them from a data or a patient relationship point of view, they have asked. So I guess that a short answer to that is it's hard not to be dependent on them to some extent, I would say. Ultimately, they are an avenue to gain a lot of reach, a lot of trust initially at the start, and to plug into all of their different capabilities, like their payment infrastructure and just their reach, as I mentioned. So I think it's going to be mutually beneficial to be dependent on them, at least at the start. But that comes with maybe another caveat, which is we've seen that some of the partnerships tend to avoid single sourcing. So wherever pharma has partnered with some of these companies, it's very much on a single element of maybe the whole patient journey. So picking a particular super platform for engagement maybe, and then a different one for triage, or a different one for fulfillment, or some of the more delivery or commerce points of view. So no single platform would end up owning your entire patient journey to that extent. So a bit of a modular approach. I think that's, from our assessment, I think that's probably a good one and a safe one to explore. Yeah, I think beyond that, some of the cross-border data laws to be fully fleshed out, again, as Christina mentioned, like right at the start, like build those in from day one. And yeah, I think beyond that, just using that Eli Lilly and JD Health example, anchor the partnership very much within a specific therapeutic area would probably be another point. I think specificity in this regard is good. Having more of an open-ended goal, if you were present in China, around just generating real-world evidence across many different pathways is maybe less favorable. So really anchor it into a specific therapeutic area, a certain protocol, a certain clinical area can just help you get more of a foothold, I think. So.
I think we still have a bit more time. I'm going to read out another one. Given US-China data export rules and the geopolitical drift, can a Western company realistically generate and own real-world evidence inside Chinese hospitals? That's a very good one. Yes, but own needs to be interpreted carefully. A Western company can absolutely generate real-world evidence in China, specifically through hospital partnerships, local CROs, these Hainan Bao Legend type pilots that Porrick was mentioning before, disease registries, platform link programs. That's totally feasible. But they should not assume that Chinese patient-level data can be freely exported. Pooled globally or used exactly like in the US or in the EU. The more realistic model is like generate real-world evidence locally, analyze it through China resident infrastructure, then use it for China regulatory access, HEOR, and medical strategy, and then export only approved, aggregated, or legally cleared outputs. So yes, we believe Western companies can generate real-world evidence in China, only that the winners in this sense will be those who design for local ownership, local compliance, and local value first, rather than assuming China real-world evidence can simply be plugged into a global data lake. So that's something important to take into account. So I believe there are a few other questions that I see here, but I think we are coming to an end. Thank you very much for joining us today, and we wish you all a pleasant day ahead.
Thanks again to everyone that joined us today. Please visit our website, HLTH.com, or scan the QR code to learn more about Health Advisory. Join us in Amsterdam, June 15th to 18th for Health Europe.